Hi guys, today I'm going to go over placing an emergency umbilical line, and this is part of NRP for your severely depressed babies is the setting that we're going to be in. We have these little bags that are made up that have all of your stuff for your emergency umbilical line, everything that you would need. So let me go over what is in this. It is located in our kangaroo board, all in this baggie. So the items that we have is we have a cord clamp remover. We have umbilical tape. This looks like, when you open it, it looks like shoestring like this that will need to be cut. We have iodine swabs, a scalpel, a vein pick that they may ask for. We have some little 2x2 sterile gauze, a 10 milliliter saline flush, a stopcock, and also a tegaderm. Let me get out my 10 milliliter saline flush. We do have two lines that are in there. They will just need one of them. We'll ask the provider which one they want. We have a silicone one, and then we have the argyle one. The argyle one is a little bit more firm. That's one of the differences. The other difference is the argyle one does not come with a stopcock on it. We will have to add that. These are both single lumen umbilical lines that we are using. So this is a baby that would be getting coordinated chest compressions and ventilation. Both of those people that are doing that would be standing more at the head of the baby, at the head. We would have the leaves, that little heart on the baby's back, and we'd have our oxygen turned up to 100%, and this baby would be intubated. So we would be at the point that we needed to give meds if we have already gotten ventilation established. We have done coordinated chest compressions and ventilation for 1 minute, and our heart rate is still less than 60. So if it is your task to draw up meds, within 1 minute of the provider asking, we should be able to have our epi pulled up, and just refer back to the video that we did about 2 months ago that shows how to draw up the epi. Also within 1 minute of them asking for the umbilical line, we should have that ready for them. Basically, we just want everything open that is in this kit, ask them which line, and prepare that line. So I'm gonna prepare the argyle line. So I'm just gonna open it up. I'm gonna take the stopcock, use the male end, and screw it in right here. Now, anything in NRP or really that does not go, it will not fit. So that's the only one that'll fit on there. So I have the stopcock. This is just this protective sheath that it is in right now. I'm gonna wanna take my 10 milliliter syringe, and I'm gonna prime the line. So I'm gonna plug this in right here. It's just gonna screw in. Wherever your stopcock is pointing is off. So right now, I'm just gonna turn it off right here. That's where my medication will go. There would be a cap right here in the new one. And I'm just gonna flush this whole line. I just had some fluid come there. Now I'm gonna flush right here where my medication is going to go. So now I have it ready. So what my provider is going to do, I'm gonna turn my baby around kind of so you can see. I'm going to take my iodine. I'm going to clean the cord. I'm going to take the umbilical tape, and I'm going to tie the cord. Now there would be a cord clamp right here, so I'm going to need to remove that. This baby has a beautiful long piece of cord. Sometimes that might not be the case if it was a cord avulsion or just something else that was going on with delivery. So they might, if it's really short, they might want to use the cord clamp remover. But ideally, I'll just make a nice cut with my scalpel. Then take the line that you have prepared ahead of time. And the NEO will be doing this. They're just going to take that, insert that into the umbilical vein. They might need the vein pick if they either can't see it well or they need help. They could use this vein pick at that point. Go put it in about 3 to 5 centimeters until they get blood return. And then we do have these nice, like, secure device, probably in an emergency. Not gonna use this, just gonna slap some Tegaderm on it. So one of these Tegaderms. So we want to be able to give this epi pretty quickly. So if this is a 2 kilo baby, I would anticipate my provider asking for 0.4 of epi in a 1 milliliter syringe. I'm gonna screw that in right here. Now right now I have it turned off to my baby. I wanna turn it off to my saline, because if I don't and I push this, it's only gonna just fill into my saline. So I'm turning my saline off. I'm pushing it fast. Then I'm gonna turn it off to my medication, and I'm going to flush with 3 milliliters of normal saline. Once I flush, I'm gonna turn it off. I'm going to say each of these things as I do them. When the provider asks for that dose, I'm going to repeat it back to them, the amount that they want. When it's given, I'm gonna say the amount that was given, and I'm gonna look at my APGAR timer, and I'm gonna go by that. That way my recorder, they know for sure that that's when it was given and how much was flushed. And then we're just gonna keep, are we still giving good chest compressions and ventilation, repeating our epi every 3 to 5 minutes.